Welcome. Today, we're diving into the world of pituitary hypogonadism, a condition that affects hormone production crucial for sexual development and reproduction. Join us as we explore its causes, effects, and management strategies, ensuring you have a comprehensive understanding of this condition. Pituitary hypogonadism arises when the pituitary gland, a small but mighty organ at the base of the brain, fails to produce enough of the gonadotropins. These hormones, luteinizing hormone and follicle stimulating hormone SSH, are vital messengers that tell the testes in males and ovaries in females to produce sex hormones like testosterone and estrogen. The why behind this pituitary malfunction can be multifaceted. It could stem from genetic conditions such as Kallmann syndrome, where the brain's development is disrupted, preventing the proper migration of hormone-releasing neurons. Pituitary tumors, benign or malignant, can also compress or damage the gland, impairing its function. Other culprits include head trauma, infections like meningitis or encephalitis, radiation exposure to the brain, and certain autoimmune disorders that mistakenly attack the pituitary gland. Now let's break down the pathophysiology. When the pituitary gland falters, the domino effect begins. Reduced LH and FSH levels disrupt the normal signaling pathway to the gonads, the testes and ovaries. Consequently, these organs produce insufficient amounts of testosterone or estrogen. In males, this leads to impaired sperm production, decreased libido, and erectile dysfunction. In females, it can cause irregular or absent menstrual cycles, infertility, and decreased bone density. The lack of these hormones also affects secondary sexual characteristics, such as facial hair growth in men and breast development in women, impacting physical development and overall well-being. Determining the exact epidemiology of pituitary hypogonadism is tricky, as many cases may go undiagnosed. However, we know certain genetic conditions, like Kallmann, are relatively rare, affecting approximately 1 in 8,000 males and 1 in 40,000 females. Pituitary tumors are more common, but only a fraction causes hypogonadism. Factors such as age, gender, and pre-existing health conditions influence the likelihood of developing this condition. Individuals with a history of head trauma, brain infections, or radiation exposure are at a higher risk. The signs and symptoms of pituitary hypogonadism vary depending on age, sex, and the severity of hormone deficiency. In males, common signs include delayed puberty, decreased muscle mass, reduced facial and body hair growth, erectile dysfunction, infertility, and decreased libido. They might also experience fatigue, depression, and loss of bone density. In females, symptoms can include delayed puberty, absent or irregular menstrual periods, infertility, vaginal dryness, loss of libido, hot flashes, and decreased bone density. Both sexes may experience fatigue, weight gain, and cognitive difficulties. Recognizing these diverse symptoms is crucial for early detection and intervention. Diagnosing pituitary hypogonadism involves a comprehensive approach. First, a thorough medical history and physical examination are conducted. Next, blood tests are crucial to measure the levels of LH, F-safe testosterone in males, and estradiol in females. Low levels of these hormones, coupled with normal or low LH, typically point toward a pituitary issue. Further investigations may include imaging studies like MRI to visualize the pituitary gland and rule out tumors or structural abnormalities. In some cases, stimulation tests, where the pituitary gland is challenged to release hormones, can provide additional information about its functionality. Pituitary hypogonadism can be broadly categorized into congenital and acquired forms. Congenital hypogonadism is present from birth, often due to genetic factors like Kallmann syndrome. Acquired hypogonadism, on the other hand, develops later in life due to causes such as pituitary tumors, head trauma, or infections. Recognizing the type of hypogonadism is essential for tailoring the appropriate treatment plan. The primary goal of treatment for pituitary hypogonadism is to restore normal hormone levels. Hormone replacement therapy is the cornerstone of management. In males, testosterone replacement therapy can be administered through injections, patches, gels, or oral medications. This helps to improve libido, muscle mass, bone density, and energy levels. In females, estrogen and progesterone replacement therapy, often in the form of pills, patches, or creams, can alleviate symptoms such as hot flashes, vaginal dryness, and bone loss, and restore menstrual cycles. If a pituitary tumor is the underlying cause, surgery, radiation therapy, or medication may be necessary to shrink or remove the tumor. Regular monitoring of hormone levels and adjustment of medication dosages are crucial for optimizing treatment outcomes. Preventing pituitary hypogonadism is not always possible, especially when it stems from genetic conditions. However, minimizing the risk factors associated with acquired hypogonadism is crucial. This includes protecting the head from trauma, promptly treating infections affecting the brain, and avoiding unnecessary radiation exposure to the head. Regular medical check-ups and awareness of potential symptoms can aid in early detection and timely intervention. The prognosis for pituitary hypogonadism is generally good with appropriate treatment. Hormone replacement therapy can effectively manage symptoms and improve the quality of life for most individuals. Recent research is exploring novel hormone delivery methods and personalized treatment approaches to optimize outcomes. For example, studies are investigating the use of selectogen receptor modulators, SIRMs, and new forms of testosterone replacement with fewer side effects. Continued research efforts hold promise for further advancements in the diagnosis and management of this condition. Remember to consult with your healthcare provider for personalized advice and treatment options.